Today we will be discussing inguinal hernias in males. An inguinal hernia is the protrusion of a portion of the intestines or tissue through a weak point in the abdominal wall, usually caused by increased pressure in the abdomen. An increase in abdominal pressure is commonly due to heavy lifting and straining. For this reason, inguinal hernias occur quite often in males, and roughly 25% of males will develop an inguinal hernia in their lifetime. But let's begin with describing the relevant anatomy important in understanding this condition.
This tube-like structure is the inguinal canal, which contains the ilioinguinal nerve as well as the spermatic cord. The ilioinguinal nerve supplies feeling to this area, while the spermatic cord houses the testicular artery and vein, the vas deferens, and other important blood vessels. The spermatic cord is important in providing blood to the scrotum and testes. The superficial inguinal ring is the exit of the inguinal canal, and the deep inguinal ring forms the entrance to the canal, which again contains both the spermatic cord and the ilioinguinal nerve. Superior to the inguinal canal is the abdominal cavity. The wall of the cavity can sometimes become weak, which allows for abdominal contents, such as the small or large intestine, to push through. This weak point is commonly known as the inguinal triangle, formed laterally by the rectus abdominis muscle, superiorly by the epigastric artery, and inferiorly by the inguinal ligament. When these contents push through the inguinal triangle, they can enter into the inguinal canal, disrupting the groin area. Specifically, a male child's testes must descend through the inguinal canal. The testes lie outside of the body because the optimal temperature needed for sperm to develop is a few degrees cooler than that of the core body temperature. The opening for the testes to descend is known as the internal inguinal ring. If the ring does not close properly after the testes descend, an inguinal hernia can develop in the infant.
There are some factors that increase the likelihood for a male to develop an inguinal hernia. One factor is being overweight or recently losing a large amount of weight. This is because a large weight loss depletes the abdominal wall of its necessary protein and other nutrients that are required for adequate muscle strength. Another main factor is excessive lifting of heavy items, because this puts a lot of stress on the abdominal wall muscles, making it easier for tissues to protrude through the wall. Other cases include straining during urination or bowel movements, chronic coughing, for example from smoking, a poor diet, and lack of exercise. A male also has a higher risk of developing an inguinal hernia if they have muscle weakness congenitally or resulting from older age, have had an inguinal hernia in the past, or have a family history of inguinal hernias. In addition, other factors that are uncontrollable but lead to inguinal hernias include being born prematurely with a low birth weight, which is less than 3.3 pounds, having an undescended testicle or testicles, or having birth defects such as exhibiting both male and female genitalia, incorrect positioning of the urethra either on top of or below the penis, or fluid buildup around the testicles. While most inguinal hernias cannot be prevented, especially in infants and children, there are certain actions a male can take in order to decrease his likelihood. One thing a male can do is try to avoid becoming overweight, since this leads to an increase in abdominal pressure. Males can decrease this risk by following a proper diet and avoiding rapid weight loss. Other preventative measures a male can do is stop smoking or do not start smoking, avoid being constipated, and keep from straining during urination and bowel movements. Lastly, and most importantly, a male should make sure he is using correct body mechanics when lifting heavy objects with their legs and not their back.
If you happen to develop an inguinal hernia, there are different types and severities. For this reason, they are classified specifically according to the presenting symptoms. They are first classified as either reducible or irreducible. Reducible inguinal hernias have abdominal contents that end up in the inguinal canal but are able to be reduced or pushed back into the abdomen by hand. Irreducible or incarcerated inguinal hernias have abdominal contents that are unable to be pushed back into the abdomen by hand. Incarcerated inguinal hernias can become strangulated, meaning that the blood flow to the small intestine is cut off or strangled. This complication requires immediate treatment because the small intestines can become necrotic. In summary, reducible inguinal hernias are the least severe. Incarcerated or irreducible inguinal hernias are moderately severe, and strangulated inguinal hernias are the most severe and even life-threatening. Secondly, inguinal hernias are either direct or indirect, given how they were caused. Direct inguinal hernia is the term used when the contents push through a weak point in the abdomen. This type usually develops in adulthood from the natural aging process or exercise. An indirect inguinal hernia occurs as a result of the deep inguinal ring, or the beginning of the inguinal canal, failing to close during development. As previously mentioned in the beginning of this video, if it remains open after the testes have descended into the scrotum through this area, it can allow abdominal contents to push through.
The first sign of an inguinal hernia usually presents itself through a minuscule bulge on either one or both sides of the male's groin. They are normally not noticed externally, however, they can cause the individual a great deal of pain internally. Inguinal hernias appear as a bulge in the groin area because they do not protrude through the surface of the skin. These bulges vary in size along the pubic groin areas and normally increase in size when the male coughs, rises to stand, or participates in strenuous exercises. However, many may decrease as time passes or when a male lies supine. How do you know if you have an inguinal hernia? Some of these symptoms that are associated with this type of hernia are sharp stabbing pains, burning sensations, swelling in the area of the scrotum, vague bulky feeling in the groin that is sometimes accompanied by a sense of fullness and or weakness in the groin area. A physical exam where the medical provider will focus on searching for a bulge or prominence in the groin area is usually given in order to diagnose an inguinal hernia. The patient can be asked to stand or cough during the exam, which can make the hernia more prominent and easier to detect. If it is unclear whether or not the patient has an inguinal hernia, imaging tests can be ordered. These include an abdominal ultrasound, CT scan, or MRI. There are two main surgical procedures that can be used to repair an inguinal hernia, but usually the first attempt to fix it is non-surgically. During this procedure, the doctor attempts to push the hernia back into place while the patient is lying down. This technique sometimes can only be a temporary fix, however, surgery is a better option in many cases. The two main surgical options for hernia repair are open and laparoscopic hernia repair. Both have their own benefits and downsides. In an open hernia repair, the patient is given general anesthesia and the surgeon makes an incision at the patient's groin area. Once this is complete, the surgeon attempts to push the hernial tissue back into the abdomen. Sutures and synthetic mesh are used to close the incision after the procedure is complete. An open hernia repair is considered a more invasive procedure because it involves a larger incision than a laparoscopic method. In a laparoscopic hernia repair, the surgeon uses a camera and instruments to explore the inside of the patient's abdomen, as well as synthetic mesh to help repair the hernia. An attractive quality for this procedure is the fact that it leaves minimal scarring, recovery time is usually shorter, and recurrence is less likely to occur. Depending on the size of the patient's inguinal hernia, the surgeon must decide on an open or laparoscopic method. Generally, smaller hernias are treated laparoscopically, and larger hernias are treated with open repairs.
We hope you enjoyed our video and learned a lot about inguinal hernias. Thank you for watching.